Navigating cannabis use during pregnancy and chest or breastfeeding. A quick disclaimer about the language and terminology used before we get into this section of the course. It is important to note that specific language will be used throughout this section. These terms include chest feeding and breastfeeding. While the term breastfeeding has historically been used to describe the process of feeding a baby from a mother's body, it may not be representative of all parents. Given this, language has evolved and is moving in the direction of using a gender-neutral term. Chest feeding is a term that some parents who identify as transmasculine and non-binary use to describe how they feed their children from their bodies. A person who uses the term chest feeding may or may not have had any surgery on their breast tissue. So what does the research say? Research is limited due to few studies being conducted using human subjects. The prevalence of Canadian folks of reproductive age who report using cannabis is increasing. Since the legalization of cannabis in Canada, 4 to 11% of people reported using cannabis during their pregnancy and/or periods of nursing. Among women identifying people aged 15 to 44 who have used cannabis and have given birth within the last 5 years, 5% had reported using cannabis during their pregnancy, and 6% reported using cannabis while chest or breastfeeding. While research is limited, current evidence suggests that cannabis use during pregnancy and/or chest or breastfeeding is not risk-free and requires further examination to fully understand both the benefits and the risks of cannabis use during pregnancy and nursing. Why might this matter? Well, to begin, cannabis use while pregnant and/or breastfeeding or chest feeding is highly stigmatized. Based on a study from the Native Women's Association of Canada, a participant said, "I get information from online because I have asked doctors about information and I get that stigma right away." Another reason why this matters is because healthcare providers may not have enough knowledge to support patients that use cannabis. Some quotes to support this come from Métis participants, and this helps us share community perspectives. The first participant said, "Information is coming from peers or online, and it's very sporadic, and it's in like droplets. And it's not really regulated information that people can say, like, this is what you need." Another participant had shared that local community health nurses discuss the pros and the cons, but they focus on the cons. Cannabis can have many effects during pregnancy. These include preterm labor or stillbirth, neurodevelopmental impacts, cognitive, social, and motor impacts, low birth weight, drowsiness and disturbed sleep, reduced memory function, and increase in hyperactive, impulsive, and aggressive behavior. Cannabis can also have effects on breastfeeding and chest feeding. Cannabinoids are stored in body fat, meaning that cannabinoids can stay in the milk for up to 6 weeks after consuming cannabis. Unlike with alcohol, pumping and dumping after using cannabis will not be effective in ensuring that there are no cannabinoids being transferred to the nursing baby. Cannabis can also affect the production of prolactin, a hormone that is responsible for milk production. This can result in reduced milk production and milk supply being delivered for the baby. How can you mitigate the harms of cannabis during pregnancy and/or chest or breastfeeding? Most health professionals will advise patients that are pregnant or lactating to avoid consuming cannabis and utilize different methods to cope. Understanding that an abstinence-based approach may not work for everyone, it is important to use a harm reduction lens to limit potential harms. This can look like reducing the levels of THC consumed, favoring CBD products, and using non-smoking methods of consumption. The big takeaway here: everyone is different, so an individualized approach is needed when considering how to reduce potential harms of cannabis use. So what alternatives can you use to treat pain and nausea while pregnant, rather than using cannabis? Well, if you're experiencing nausea, some options for you are salty foods, staying hydrated, so ensuring that you have lots of water, juices, teas, soups, juicy fruits and vegetables. You can also use safe herbs. So ginger is really safe to use in pregnancy and is a good option. And the final alternative is to use over-the-counter meds such as aspirin and Gravol. To treat your pain while experiencing pregnancy, you can use physical therapies such as physiotherapy, massage therapy. You can also use mindfulness practices. This can include meditation, body scans, breath awareness. And you can also try gentle exercise. For example, yoga, walking, swimming. If you're experiencing anxiety during pregnancy and postpartum, and typically use cannabis to treat this, there are some alternatives that you can try. You can use the same examples that were used for pain, and these can also be used to manage anxiety, but you can also use, in addition to those, the following components, such as personal practices, so this may include journaling or meditation, and really rely on community support. Community support will include friends, family, people with the same values. Now, for those of you that are joining as a healthcare provider, you may be wondering, how do you change your practices to create a stigma-free environment where your patients are not afraid to discuss their struggles with cannabis? There are many options for you, but to name a few, you can start by creating spaces that are culturally safe and offer traditional healing. You can also create a toolbox that's available to patients with resources that can be accessed to share additional knowledge that patients can then make an informed decision about their cannabis use. The final option is to use an integrated care approach with support teams to assist with pregnancy and postnatal care.